following video on adult CPR will provide a 4-step process on how to learn and practice adult CPR. Let's demonstrate adult CPR. Check the area for danger. Try to wake the person up. If they're not responding, open the airway and check for breathing for no more than 10 seconds. If the person is not breathing, call 911. Have a bystander make that call for you. Get an AED if available. Landmark on the chest and give 30 compressions. Push hard, push fast, at a rate of at least 100 compressions per minute. Secure the mask over the face, open the airway, and give 2 breaths. 1 breath goes in, 2 breaths go in. Repeat cycles of 30 compressions and 2 breaths until EMS arrives, someone comes and brings you an AED, you see signs of life return, you're too physically exhausted to continue, or the area becomes dangerous. If you are providing mouth-to-mouth resuscitation, you need to do a head tilt chin lift and place your mouth over the person's mouth with a tight seal. Pinch their nostrils shut and ventilate. You can also use mouth to face shield rescue breathing.
All right, we're gonna break this down now for everyone, okay? So first thing we're gonna do is we're gonna landmark on the chest, okay? Take your hand, put it under the armpit, and slide straight across so that the heel of the hand stops right on top of the sternum. It's very important that the heel of the hand is directly on the sternum and you are in between the person's chest muscles, okay? Straight across from the person's armpit. All right, now grab your other hand, place it over the hand that's landmarked on the chest, interlock your fingers, come straight up, perfect, get a 90-degree angle and lock your elbows. Excellent. I want you to do a couple of compressions for me, okay? Abbas, go ahead. And as you're doing these compressions, I want you to feel the recoil on the way up and the resistance on the way down. All right, we're gonna say this is at least 2 inches. So when we're doing compressions, we want full range of motion compressions, allow complete recoil of the chest, and push until you feel resistance. Okay, it's very important that we push hard and push fast, exactly at this rate that you're doing right now, Abbas, which is at least 100 compressions per minute. Okay, excellent. So now what we're gonna do is we're gonna do the breaths. All right, grab your mask, pop the mask out so the mouthpiece is raised. You're gonna put the pointy part of the mask toward the nose of the person. All right, you're gonna secure the mask in place. Very good. Now, the hand that's on the forehead is going to secure the upper part of the mask, and the other hand that's gonna be doing the head tilt chin lift secures the lower part of the mask, but if you look at the middle finger, and you're gonna put that finger right underneath the chin. Perfect, exactly how you have it. All right, you're now ready to ventilate. So let's open the airway. We're gonna give 1 breath. Each breath should be 1 second, enough to see chest rise, which I saw. Give me another breath. Perfect, good job, chest rise. Making sure not to give too much air, because if you give too much air, you can actually cause the person to vomit, all right? And this is called gastric distension. So perfect amount of air, perfect compressions. Let's see one more time. Hand landmark on the chest, interlock fingers, and 1 and 2 and 3 and 4. Great job, Abbas. You're doing perfect compressions. Nice job. Excellent. Allowing complete recoil, push until you feel resistance, landmarking on the sternum. All right, let's do the breaths. Head tilt chin lift, excellent. Secure the mask, watch for the chest rise. Chest rise, and back to compressions right away. And 1 and 2 and 3 and 4. All right, very good. Excellent job, Abbas.
Let's practice adult CPR. Check the area for danger. Try to wake the person up. If they're not responding, open the airway and check for breathing for no more than 10 seconds. If the person is not breathing, call 911. Have a bystander make that call for you. Get an AED if available.
Okay, starting CPR, landmark. and 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30, and 2 breaths. Open the airway. Breath goes in. Breath goes in. Continuing CPR, landmark.
Repeat cycles of 30 compressions and 2 breaths until EMS arrives. Someone comes and brings you an AED. You see signs of life return. You're too physically exhausted to continue, or the area becomes dangerous. Let's practice adult CPR by playing a game. I will partially guide you through the skill, but you will need to fill in the blank and perform the step at the same time. Ready? Check the scene for. Check for level of. Open the person's. Check to see if the person is. Call. Landmark on the chest. Place the heel of your hand in between the person's what? Give how many compressions? Give 2. Repeat cycles of 30 what and 2 what? Excellent. You did it. That was fun. Great practicing. Great. Let's practice one more time by playing a game of follow the leader. I will show you 2 steps, and then you show the same 2 steps. Ready?
Ready. All right, let's do it. Check the area for danger. Is the area safe? If there's nothing that's going to harm you, approach the person and try to wake them up. Gently tap them and shout, wake up, are you okay? Wake up, are you okay? Open the airway using a head tilt chin lift. Look, listen, and feel. Check for breathing. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000. All right, no more than 10 seconds. The person is not breathing. I want you to. I want you to point to a bystander. Tell them to call 911. Tell them we need an ambulance. We have someone who's unconscious and not breathing. Ask them, do they understand? Tell them to report back to you. And ask someone to bring an AED as quickly as possible. All right, let's start CPR. We're gonna landmark on the chest, place your hand under their armpit, slide straight across, hand over hand, and let's do 30 compressions. And 1, and 2, and 3, and 4, and 5, and 6, and 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 30. Open the airway, place the mask over the face first. Pointy part of the mask goes to the nose. Open the airway, secure the mask, and ventilate once. Breath goes in, ventilate twice, breath goes in, and back to compressions. Good job. And in and back to compressions. Good job. And 1 and 2, 3 and 4 and 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, open the airway, breath goes in, chest rise, breath goes in, chest rise, and back to compressions right away. And